Before we begin, please subscribe, Dr. Thomas Richard, and I need to tell you something that might save your life today. That number you saw, because what you're about to hear could protect your heart, your kidneys, and maybe your life. If you are between 70 and 85 and you take Amlodipine Losartan or Lisinopril for blood pressure, there is something I need you to understand right now before we go any further. Some of the most dangerous medication reactions do not begin with a dramatic collapse. They do not always begin with a siren, a panic, or a trip to the emergency room. Sometimes they begin with tighter shoes. Sometimes with a cough you keep blaming on the weather. Sometimes with weakness when you stand up. Sometimes with swelling that looks harmless until suddenly it isn't harmless at all. And that is exactly why so many older adults ignore the early body changes their medicine is trying to warn them about. These medications can be excellent medicines. Let me be very clear about that because I never want fear to replace good judgment. Amlodipine, Losartan, and Lisinopril help millions of people lower blood pressure, reduce strain on the heart, and protect organs that high blood pressure silently damages over time. They can prevent strokes. They can lower the risk of heart failure getting worse. They can help preserve kidney function in the right patient. But even good medicines can send important signals through the body, and if you do not know how to read those signals, you can mistake a warning sign for something minor, or worse, you can dismiss something dangerous as just part of getting older. And today, I'm going to walk you through the body changes you should never ignore while taking these medicines. Not because every symptom means disaster, but because the body often whispers before it screams. We're going to count down the warning signs that deserve your attention, and the last one, number 1, is the one that can become life-threatening so fast that waiting it out is the worst thing you can do. But before we get there, promise me something. Do not stop your blood pressure medication on your own just because you recognize one of these signs. The goal is not panic. The goal is recognition, action, and getting the right help at the right time. Let me start with Eleanor. I'll call her Eleanor. She was 76, lived in Ohio, and had done exactly what her doctor asked. She took her blood pressure pill every morning. She kept her appointments. She tried to walk after dinner. She was the kind of person who never wanted to bother anyone, and that personality nearly got her in trouble. She noticed a change first in her energy, not crushing exhaustion, not sudden collapse, just a quiet, dragging feeling. Getting dressed felt heavier. Going up the front steps felt slower. Folding laundry felt like a project instead of a task. She told herself it was age. She told herself it was the weather. She told herself it was poor sleep. What she did not realize was that the body often announces trouble with a small subtraction of strength long before it announces it with pain. So let's begin with body change number 11, unusual fatigue, weakness, or a sense that your body suddenly has less reserve than it used to, especially after starting the medicine, after a dose increase, or after adding another blood pressure medication. This matters because when blood pressure drops too much, or when your body is not tolerating the medication well, the first sign is not always a number on a monitor. Sometimes the sign is that your morning routine becomes mysteriously harder. You feel washed out. You feel weak in the legs. You need to sit down halfway through simple chores. That does not always mean danger, but it is never something to keep ignoring for weeks. Persistent fatigue can point to blood pressure running lower than you realize, dehydration, kidney stress, or a general mismatch between your dose and what your body now needs. Now, here is where people make a mistake, and it's a costly one. They assume weakness is normal aging because it arrived gradually. But medication-related fatigue often has a pattern. It shows up after a new prescription. It appears after a dose change. It gets worse in hot weather, after poor hydration, or after you have been ill. If you notice that your tank is suddenly emptier than it was 2 weeks ago, write it down. Check your blood pressure sitting and then standing if your doctor has shown you how. Notice whether the weakness is constant or tied to when you take the pill. That information matters. And if that fatigue is paired with dizziness, faintness, less urination, chest symptoms, or swelling, then it is no longer a watch and wait situation. It's a call your doctor situation. Body change number 10 is a warm, flushed face, pounding heartbeat, or nagging headaches that seem to appear after taking the pill, especially with amlodipine. Let me tell you about Frank from Arizona, 72 years old, who thought his medication wasn't doing anything except making him feel strange. He described it this way: "My face gets warm, my heart feels more noticeable, and I get this little pressure in my head by late afternoon." Because it was not severe, he ignored it. Because it came and went, he dismissed it. And because he could still function, he never mentioned it at his appointment. But those symptoms matter because amlodipine works by relaxing blood vessels. That can be helpful for blood pressure, but in some people, especially when the dose is higher or the body is more sensitive, that vessel relaxation can show up as flushing, headache, or palpitations. Now, that does not automatically mean the medicine is dangerous for you. Sometimes these symptoms settle as the body adjusts. But if the pounding heartbeat is new, if the headaches are persistent, if the flushing is accompanied by chest discomfort, breathlessness, or feeling faint, do not normalize it, because your body may be telling you the dose is not sitting well with you. And one more thing. Older adults often underreport palpitations because they describe them as just feeling my heart more. That phrase is important. If your heartbeat feels racing, thudding, skipping, or more forceful than usual after starting or increasing amlodipine, say that out loud to your clinician. Small descriptions can prevent big problems. Body change number 9 is a dry cough that will not leave you alone, and this one points especially toward Lisinopril more than the other two medicines. Let me tell you about Barbara from Tennessee, 74, who spent 3 months convinced her house was too dusty. She changed air filters. She bought a humidifier. She tried honey, tea, lozenges, and every home remedy her sister could think of. But the cough kept coming back, especially at night. It was dry. It was tickly. It was not deep in the lungs. It did not feel like a cold. And the key detail, was that it began not long after she started Lisinopril. This is one of those side effects that can sound small to everyone else and feel enormous to the person living with it. A cough like this is often not dangerous in the immediate sense, but it is not trivial either. Sleep gets worse. Throat irritation builds. Anxiety rises because you start wondering what else could be wrong. And older adults, especially those already dealing with fatigue or heart issues, lose resilience fast when sleep is interrupted night after night. If you take Lisinopril and develop a dry, stubborn cough that hangs around without another clear explanation, that is not something to silently tolerate for months. It may be the medication, and sometimes a doctor can solve the problem by changing the treatment rather than making you suffer through it. What matters is recognizing the pattern early and not assuming every long-lasting cough is just allergies, reflux, or old age. Body change number 8 is swelling in the ankles, feet, or lower legs. And if you are on amlodipine, this is one of the biggest signs you should respect. Let me tell you about Martha from Georgia, 79, who noticed first that her socks were leaving deeper marks. Then her shoes felt tighter in the evening than they had in the morning. Then one day she looked down and realized her ankles no longer looked like her ankles. She wasn't in pain. She wasn't short of breath. So she told herself, it's just heat, it's just salt, it's just sitting too much. But the swelling kept returning. That pattern matters because amlodipine is well known for causing fluid pooling in the lower legs, especially in older adults, and especially after the dose goes up. Here is the part people miss. And this is very important. Swelling from amlodipine does not always mean your heart is failing, and it does not always mean you drank too much water. In many cases, it happens because the medicine relaxes arteries more than veins, which changes pressure in tiny blood vessels and lets fluid move into surrounding tissues. That is why some people notice both legs getting puffy by evening and then improving overnight after lying down. But do not let that fool you into ignoring it. Medication swelling may not be an emergency by itself, yet it is still a sign that your body is reacting. If swelling is new, worsening, painful, or paired with breathlessness, chest pressure, or rapid weight gain, it needs prompt medical attention. And if it is simply persistent, even without pain, it deserves a conversation because living with swelling is not the same as tolerating the medicine well. Body change number 7 is dizziness when you stand up, lightheadedness, or that sudden whoa sensation when you rise from bed or get out of a chair. And this can happen with all 3 medications. Let me tell you about Calvin from Michigan, 81, who had a terrifying experience in his kitchen. He stood up from breakfast, turned toward the sink, and the room seemed to tilt. He grabbed the counter just in time. He did not pass out, but he came very close. The scary part was not just the dizziness. The scary part was how easily that could have become a fall, a broken hip, or a head injury. Older adults do not always get a second chance after a fall, and blood pressure medications can quietly increase that risk if blood pressure drops too far or changes too quickly when you stand. This gets worse when dehydration enters the picture. A hot day, a stomach bug, not drinking enough, taking a water pill with one of these medicines, sweating more than usual. Suddenly, the same dose that felt fine last month feels too strong today. And because many seniors are disciplined, they keep taking the medicine exactly the same way without realizing their body's fluid balance has changed. If you feel dizzy rising from a chair, if your vision goes gray for a moment, if you feel faint after taking your pill, do not shrug that off. Sit down, move more slowly, hydrate if you are allowed to do so, check your pressure if you can, and call your doctor if it keeps happening, because recurring near fainting is not a personality quirk of aging. It is a sign your circulation may need closer attention. Body change number 6 is a change in urination. Passing much less urine than usual, having darker urine, feeling new lower back discomfort, or noticing that your body suddenly seems to be retaining fluid in a way that is different from simple ankle puffiness. Especially if you take Losartan or Lisinopril. Let me tell you about Walter from Missouri, 78. He did not notice a dramatic symptom first. What he noticed was absence. He was not going to the bathroom the way he usually did. His urine looked darker. He felt off. Not sick exactly, just off. A little weak, a little foggy. He almost ignored it because there was no major pain. But kidney stress often begins like that. Quietly, subtly, indirectly. Losartan and Lisinopril can be very protective for the kidneys in the right patient. And that is one of the reasons doctors prescribe them so often. But the kidneys are delicate, and when dehydration, illness, other medicines, or underlying kidney disease enter the picture, the balance can tip. That is why blood tests matter on these medications. The first sign of trouble is often on paper before it becomes obvious in the body. Still, the body does give clues. Less urine, swelling in unusual ways, new weakness, nausea, feeling increasingly unwell after a bout of vomiting or diarrhea. If you are taking one of these medicines and your urine output drops noticeably, that is not the time to just wait until next month's appointment. That is the time to pick up the phone because the sooner kidney stress is recognized, the easier it may be to reverse. Body change number 5 is muscle weakness, cramps, tingling, a heavy feeling in the legs, or a heartbeat that suddenly feels irregular. And this one is sneaky because people rarely connect it to potassium, especially while taking Losartan or Lisinopril. Let me tell you about Denise from South Carolina, 73. She kept saying her legs felt full of sand. Not painful exactly, just heavy, weak, and unreliable. Then she started getting cramps. Then she noticed a strange flutter in her chest one evening while sitting in her recliner. She blamed age, circulation, and nerves all at once. But what finally sent her in was that tingling sensation in her hands and lips that made no sense. Those symptoms can point to high potassium, and high potassium can become serious. Here is why this matters so much. Losartan and Lisinopril affect a body system that helps regulate blood pressure, kidney blood flow, and potassium balance. In many people, that is helpful. In some people, especially with kidney disease, dehydration, diabetes, or certain combinations of medications, potassium can rise too high. And high potassium is dangerous not because it makes you uncomfortable, though it can, but because it can disrupt the electrical system of the heart. Sometimes there are symptoms: weakness, nausea, tingling, palpitations, heaviness in the legs. Sometimes there are no symptoms at all until it becomes very serious. That is why this category deserves respect. If you take Losartan or Lisinopril, do not casually use potassium salt substitutes or supplements unless your doctor told you to. And if these symptoms show up together, do not Google and guess. Get checked. Body change number 4 is severe stomach trouble. And I do not mean a little indigestion after dinner. I mean persistent vomiting, ongoing diarrhea, inability to keep fluids down, or sudden severe belly pain that feels different from your usual digestive issues. Let me tell you about Helen from North Carolina, 80, who thought she had picked up a stomach bug. She was taking Lisinopril. She had diarrhea for 2 days, then vomiting, then she stopped eating and barely drank. By the 3rd day, she was so weak she could hardly stand. Her blood pressure had fallen, her kidneys were under stress, and her body no longer had the fluid reserve to tolerate the same medication dose. What looked like a simple stomach illness had turned into a medication tolerance crisis. And there is another reason this symptom category matters, especially with Lisinopril. Severe stomach pain, even with or without nausea or vomiting, can in rare cases be linked to a swelling reaction inside the body, not just on the face. That means a belly symptom can sometimes be more than a belly symptom. Add to that the dehydration problem. If you are losing fluids fast while taking blood pressure medicines, the risk of dizziness, fainting, and kidney trouble rises. So please remember this rule. If you cannot keep fluids down, if diarrhea is continuing, if you are sweating heavily in heat and feel weak, if your stomach pain is intense or unusual, do not keep taking the situation lightly. The older body decompensates faster, and what felt manageable this morning can become dangerous by tonight. Body change number 3 is yellowing of the eyes or skin, dark urine, pale stools, or pain in the upper part of the abdomen, because these can be warning signs that the liver is unhappy. Let me tell you about Joseph from Louisiana, 77, who first noticed it in the bathroom mirror. He said the whites of his eyes looked dingy. Not bright yellow, not dramatic, just wrong. Then his urine darkened. Then his appetite dropped. He felt tired in a way that was different from normal fatigue. The mistake he made, and many people make this same mistake, was thinking that if there isn't major pain, then there isn't major concern. But the liver does not always sound an alarm with pain. Sometimes it signals with color, nausea, exhaustion, and loss of appetite. These reactions are uncommon, but that is exactly why people miss them. They are not the side effects everyone talks about, so when they happen, people blame food, a virus, or simply feeling off. Amlodipine, Losartan, and Lisinopril all carry warnings that rare but important liver-related problems can occur. That means if your urine turns unusually dark, if your skin or eyes look yellow, if you feel nauseated and wiped out while your appetite disappears, that deserves prompt medical attention. Not next month, not when it is convenient. Prompt attention. Because when the liver starts sending signals, the smartest thing you can do is listen early, not wait for the signs to become undeniable. Body change number 2 is chest pain, worsening shortness of breath, fainting, or a fast or irregular heartbeat that feels wrong. Not just noticeable, but wrong. Let me tell you about Raymond from Nevada, 75. He had recently started amlodipine after a blood pressure spike. A week later, he noticed pressure in his chest while walking to the mailbox. He brushed it off because he assumed the new pill was supposed to help his heart, not create a problem. But medicines do not make us immune to emergencies. Sometimes the symptom is unrelated to the medicine and still urgent. Sometimes the medicine contributes. Sometimes the medicine uncovers a problem that was already there. The key is that chest symptoms are never something to reinterpret casually in your own favor. Amlodipine can, in rare cases, be associated with worsening chest pain or more serious heart symptoms in vulnerable people. And all 3 medicines can be part of a bigger picture involving low blood pressure, dehydration, electrolyte imbalance, or a heart that is not happy for one reason or another. If you have chest tightness, pain moving into the jaw, back, or arm, shortness of breath that is new or worsening, fainting, or a heartbeat that is fast, pounding, fluttering, or irregular that is urgent. Do not decide it will pass because it did last time. Do not wait until morning because you don't want to make a fuss. In older adults, that delay is where catastrophe hides. When the heart starts talking, you listen immediately. And now we come to body change number 1, the most dangerous one, the one I never want you to ignore. Not for an hour, not for 10 minutes, not while you see if it settles, because this one can turn critical frighteningly fast. Swelling of the lips, tongue, face, mouth, or throat, hoarseness that appears suddenly, trouble swallowing, trouble breathing, a sensation that the throat is tightening. This is the warning sign that can mean angioedema or a serious allergic type reaction, and it is especially associated with lisinopril, though it can happen more rarely with losartan too. Let me tell you about Gloria from Florida, 71. She woke up one morning and thought her lip looked a little puffy. Not huge, just odd. By midday, her tongue felt thick. Her voice sounded different. By the time her daughter arrived, Gloria was having trouble speaking clearly. That is how deceptive this can be. It does not always start with dramatic choking. Sometimes it starts with subtle swelling, with hoarseness, with a strange fullness in the mouth or throat. People waste precious time because they want certainty before they act. They want to be absolutely sure it is serious. But this is one of the few body changes where hesitation can cost you dearly. If you are taking Lisinopril or Losartan and you develop swelling of the lips, face, tongue, or throat, or you have trouble breathing or swallowing, treat it as an emergency. This is not a call next week symptom. This is not a wait for my regular doctor to open symptom. This is emergency care now. Because when swelling moves into the airway, the timeline can change from manageable to terrifying in a very short window. Now step back for a moment, because I want you to see the bigger picture. These medicines are not your enemy. Ignorance is the enemy. Delay is the enemy. Guessing is the enemy. The problem is not that people take blood pressure medication. The problem is that many older adults take it with no one ever explaining what the body changes mean, so they normalize ankle swelling. They tolerate a cough for months. They excuse dizziness because they do not want to be difficult. They hide weakness because they are afraid the doctor will add more tests. And sometimes the body is sending them a clear message that something needs to be adjusted, monitored, or treated right away. So let me give you the practical system I want you to remember. First category, symptoms you should report soon, even if they are not an emergency. Persistent dry cough, new ankle swelling, flushing, headaches, palpitations, or fatigue that began after the medicine changed. These are call the office and discuss it symptoms, not suffer in silence symptoms. Second category, symptoms that need prompt attention the same day or very quickly. Less urine, dark urine, worsening weakness, severe dizziness, repeated near fainting, severe vomiting or diarrhea, strong stomach pain, new muscle weakness with palpitations, yellow eyes or skin. Third category, symptoms that are emergencies. Chest pain, severe trouble breathing, fainting, swelling of the lips, tongue, face, or throat. Those are not monitor-at-home symptoms. Those are get-help-now symptoms. And here is something else that can protect you more than most people realize. Keep a symptom log just like you would keep a blood pressure log. Write down the date the symptom began. Write down which medicine you take, what dose, and what time you take it. Note whether the symptom appears before the dose, after the dose, every day, only in the evening, only when standing, or only in heat. If your ankles swell, note whether it is worse by evening and better by morning. If you cough, note when it started. If you feel dizzy, note whether you were sick, sweating, or not drinking well that day. This kind of pattern recognition can turn a vague complaint into a clear clinical answer, and it helps your doctor decide whether the medicine should be adjusted, replaced, or investigated further. Let me tell you about Leonard from Pennsylvania 82 because his story brings all of this together. And I think it may sound familiar to some of you. Leonard took his pills faithfully and assumed faithfulness was the same thing as safety. He developed ankle swelling on amlodipine and ignored it. Then he caught a stomach bug while taking losartan and thought the weakness and dizziness were just part of being sick. Later, when he was switched to Lisinopril, he developed a cough and kept saying, "I don't want to bother the doctor over a little cough." One medication, 3 different body messages, and each time he minimized what his body was trying to say. Nothing destroyed him overnight. That is the trap. The danger was the accumulation of ignored warnings. When Leonard finally came in, what changed everything was not some miracle test. It was the timeline. The timeline showed what started after which medication, what improved, what worsened, and what should never have been brushed aside. His treatment was adjusted. The swelling improved. The dizziness stopped after hydration and medication review. The cough disappeared after the drug change. What looked like random aging symptoms was not random at all. It was a conversation between the medicine and the body, and once somebody listened carefully, the picture became clear. That is what I want for you. Not fear, clarity, not guessing, recognition, not silence, action. So if you are 70 to 85 and taking amlodipine, losartan, or lisinopril, remember the body changes we talked about today, because they are not trivia. Unusual fatigue, flushing or pounding heartbeat, a dry, lingering cough, swelling in the feet and ankles, dizziness when standing, less urine or darker urine, muscle weakness, cramps, tingling, or irregular heartbeat, persistent vomiting, diarrhea, or severe stomach pain, yellow eyes or skin, chest pain or shortness of breath, and above all, swelling of the face, lips, tongue, or throat. Some of these mean talk to your doctor. Some mean call today. Some mean get emergency help now. The wisdom is knowing the difference, and now, you do. If this video helped you understand what these medicines can do, subscribe to the channel and share this with someone who takes blood pressure medication every day. Because the person who needs this information most is often the person who keeps saying, "I'm fine." And maybe they are fine. But maybe they are ignoring the first small body change that comes before the bigger event. Your medicine should protect you, not confuse you. Your symptoms should be taken seriously, not dismissed as age. And your body, even now, is still remarkably good at warning you when something is changing. Listen early, act wisely, and I'll see you in the next videos.